In my third trimester, I was experiencing very sharp, intense rib pain on my right side. It was keeping me up at night and I had the feeling that I could not take a deep breath ever. In today's video, I'll show you the top 5 exercises that I found the most helpful in relieving rib pain in pregnancy. But first, if you're new to my channel, make sure you subscribe and click the notification bell below so you don't miss any of my future releases. Baby's position is often the culprit when we're talking about rib pain in pregnancy. When babies are sitting higher up in the abdomen, their body ends up being right against our rib cage, especially in the third trimester once there is less space for your baby to move around. So here are 5 exercises you can try to relieve this. So the first one is a side stretch in the sitting position. So you're just gonna sit on the floor and then big stretch on the side. And then take nice deep breath into your rib cage. Really expanding that rib cage. And I would take 5 breaths on each side, maybe spending a little more time stretching the side that hurts. So in my case, it was more on my right side, so I was spending more time here. So our next one is going to be a side stretch in the child's pose position. But if your bump is too big at this point to allow this, just stick to the sitting version. So you're going to bring your knees apart and then walking your hands to the right, for example, in order to stretch the left side of your rib cage, breathing into the rib cage, exhaling all the air. Inhale. And as you go, you can even stretch a little deeper if you want. Taking 5 breaths here, and then we go to the other side and do 5 breaths on the other side. Another one that I quite liked was a rotation. So all you do is to bring that right hand to the left knee and then twist. Try to look behind you, and this hand here can help to twisting a little more. And then same thing, breathing into the rib cage. Five breaths here, and then 5 breaths the opposite direction. Ah, that feels so good. And the rotations are often something that is neglected in pregnancy. We move very linear through the pregnancy, and it's really important to maintain the rotations because postpartum, they are super important to engage the core, and especially if you're a very active person, you will need your rotation for your active lifestyle. Anyone really needs it, but especially for runners, I'm thinking, and people who are very active. And release. Another favorite of mine is to use the COREGEOUS ball to help apply pressure on the rib cage to release it. I've actually made a video with my COREGEOUS ball hacks in pregnancy. If you want to purchase one and you're like, I don't want to just purchase it for the rib cage release, I want to also take advantage of it for different things, then you can watch the video. We'll link it in the description below. So what we're gonna do here is inflate it about 50 to 75%. I could even deflate it a bit here. I like to work on the side that is most painful, but honestly doing it on both sides will just make sure that you are balanced. So I'm just going to lie on my side, put my COREGEOUS ball at the lower rib cage. So just be below the bra line, and then take a deep breath into it and then release. And let your COREGEOUS ball sink into your rib cage. And I like to do 3 breaths per area. because then we will move it a little higher up, so right at the bra line and even a little higher. And same thing. So 3 breaths here. And then we would do the same on the other side. The more inflated your ball is and the more pressure you will get. So if you want to get something a little more intense, you are welcome to inflate it more. So 3 breaths here, and then you do 3 breaths higher up. What I like about having it more inflated is also you can put it here to then, you see how it can stretch that upper side here? So it kind of inverts everything. So it can be a nice way to do a side stretch lying down if all the other versions, you know, the sitting and the child pose one was not comfortable. And the last one is a standing version. So you're gonna have your legs as wide as possible. You're going to run that hand down your leg, and then the other one goes up. And try to push those hips the other way. And again, always breathing in the rib cage. It's a nice one to stretch the muscle between your rib cage and your hip, called the QL muscle, quadratus lumborum. And then slowly come back up, and same thing on the other side.
As mentioned before, baby's position can be a huge factor for rib pain, so I highly recommend doing forward-leaning inversions on a daily basis in the 3rd trimester to promote good baby's position. I'll link my video about it in the description below if you want to try it. The other thing I would recommend is to consult with a skilled manual practitioner working with pregnant mamas, like certified spinning babies practitioner, an osteopath, a physiotherapist, or a chiropractor, just to release the tensions that may be causing your baby to be stuck in one position and pushing on your rib cage. I would appreciate if you could give this video a like if you found it helpful, and thanks so much for watching.